today. I actually want to keep you where you are, if you want to know the truth. Kevin Hassett is so good. I'm saying, wait a minute. If I move them, these Fed guys, certainly the one we have now, they don't talk much. I would lose you. It's a serious concern to me. So I just want to say thank you very much. You've done incredible. We don't want to lose him, Susie, but we'll see how it all works out, okay? Thank you, Kevin. Great job. And thank you for all being here as we discuss the largest investment in rural health care in American history. This is the big one. We're delighted to be joined by many incredible members of the healthcare community, including doctors, nurses, and pharmacists from all across America. We're also very happy to have with us some very talented people. A man who is really good at this, extremely non-controversial, which is, I wanted somebody non-controversial. So I chose Robert F. Kennedy, Jr. to head the whole shebang up. And he also happens to be a great guy. Brooke Rollins, who's doing a fantastic job at agriculture, and thank you. And how are the prices coming?
They're coming, sir, they're coming down.
Don't forget, we inherited a mess.
We sure did.
Remember eggs? They were up 4 times higher than they ever were. And in my first day, they said, what are you going to do about eggs? I said, I didn't cause the problem. We didn't cause, we inherited a mess, but the prices are coming down.
Yes, sir. Wholesale prices are down 86%. Retail a little bit less than that, but yes, you're making America affordable again.
With you in charge, I have no doubt, and I appreciate it. Thank you.
Thank you.
And administrator for the Centers for Medicare and Medicaid Services, a really good man, a really brilliant guy, Dr. Mehmet Oz. Thank you very much. Thank you, Dr. Oz. And thank you also to Governor Jim Pillen, Senator Dan Sullivan, and Representatives Rob Bresnahan, Mike Lawler, John McGuire, and Nick Begich. Thank you all for being here. Appreciate it very much. Now, we have other congressmen here, I see, and a couple of senators, and we appreciate everybody being here. Everyone wants to be a part of this. It's so important. It's maybe, I don't know, for many people, there's nothing more important. I would say maybe defense. We need defense, and we need offense, too, by the way. As part of the great, big, beautiful bill, we have increased funding for the health care by an unprecedented $50 billion. That's rural health care. Nobody thought that was going to happen, and we got it done. So we have rural health care for those that were trying to make a case that we weren't taking care of the rural community. I'm all about the rural community. We won the rural communities by numbers that nobody's ever won them before, and we're taking care of those great people. So we already did this. We increased funding for rural health care by an unprecedented, record-setting $50 billion over 5 years, which will benefit Americans in all 50 states. And this was made possible by cutting massive waste, fraud, and abuse from Medicaid and reinvesting those funds to revitalize hospitals in our cherished rural communities and hospitals in rural communities. And I want to say, with all of the fraud that we're seeing in Minnesota and California and other places, I actually think that if we do an unbelievable job, you could almost balance your budget, Kevin. If you take a look at the kind of numbers you're talking about, nobody ever saw anything like it. They're all corrupt politicians, from the governor of Minnesota to the governor of California to everybody. They're just corrupt politicians. And you're talking about hundreds of billions of dollars in fraud, waste fraud and abuse. But in fraud, you're talking about hundreds of billions of dollars. Under the Unaffordable Care Act, which is Obamacare, it's called the unaffordable. It is unaffordable, remember that. Rural hospitals and communities were devastated by soaring costs, and that continues. Despite colossal increases in government spending since Obamacare was passed, only 7% of the annual Medicaid spending on rural hospitals has gone to rural hospitals. So there's only a very little. They didn't care. Obama didn't care about the rural community, to be totally blunt. What he did care about is insurance companies. And this was a bill to make insurance companies wealthy. And they did. They made insurance companies very wealthy. I would say they don't like me too much because they spent hundreds of billions of dollars, and we're going to have that money spent to the people and given to the people, not we're going to circumvent the insurance companies. Partially as a result, rural healthcare facilities have suffered from low occupancy rates, workforce shortages, and failing programs that put Band-Aids, literally put Band-Aids over the problems in those communities.